Hi everyone, this is Carlos Gomez. This is my MBB project submission. This is going to be about oppositional defiant disorder. I chose this topic because, in the past when I've worked at nonprofits, I have worked with a lot of kids who had or who were diagnosed with ODD, and it's something that I think it's definitely important to try to know what are some of the strategies and um, some of the behavioral strategies and some of the instructional strategies that we need to do or we need to know in order to kind of make our lives a lot easier on the job as counselors. So here we go. So one of the things to know about opposition is that all children are oppositional from time to time. Especially when kids are tired or hungry or stressed out or upset or what have you. They're probably going to argue with you. They're probably going to talk back with you and disobey you. Kids defy parents all the time. They defy teachers and other adults. And oppositional behavior, I mean, really, it's kind of a normal part of childhood. And so but what you have to start, or when you start getting to worry about is when they become openly uncooperative or they become hostile. And that's when it becomes a serious concern and it becomes frequent. So the definition of ODD is a disruptive behavior disorder characterized by a pattern of angry or irritable mood, argumentative or defiant behavior, or vindictiveness lasting for at least 6 months. Children and adolescents with ODD may have trouble controlling their temper and are often disobedient and defiant towards others. So see that some of the causes, doctors don't really know the exact cause of ODD, but it may result from a combination of factors. So the child's general attitude and how the family reacts to his or her behavior may play a role in it. ODD may also run in the family, and other causes may be related to the nervous system or to brain chemicals that are out of balance. Some of the symptoms of ODD, they show an ongoing pattern of extreme negativity, hostility, and defiance that is constant. It lasts about 6 months, or it lasts at least 6 months, excuse me. Um, it's very excessive compared to what the usual is for the child's age. Is disruptive to the family and the school and is usually directed to an authority figure. So that will be the authority figures in any child's life is going to be the parents, going to be teachers, principals, teachers, mentors, coaches, anybody. These are some of the behavioral symptoms that are associated with ODD. Frequent temper tantrums, excessive arguments with adults, actively refusing to comply with requests and rules, often questioning rules, deliberately annoying and upsetting others, often touchy or annoyed by others, blaming others for their mistakes, frequent outbursts for their mistakes, or I'm sorry, frequent outbursts of anger and resentment, and spiteful attitude and revenge seeking. They're very vindictive, excuse me. So these are some of the risk factors associated with ODD. There are three different types of risk factors. The first one I'm going to talk about is biological risk factors. Children and adolescents are more susceptible to developing ODD if they have some of these biological factors. One of them is being a parent with a history of attention deficit or hyperactivity disorder, ODD, or CD, which is conduct disorder, which is kind of what ODD kind of leads towards is conduct disorder. And conduct disorder is actually a little bit more severe. A parent with a mood disorder, such as depression or bipolar disorder, a parent who has a problem with drinking or substance abuse, impairment in the part of the brain responsible for reasoning, judgment, and impulse control, a brain chemical imbalance, a mother who smoked during pregnancy, exposure to toxins, and poor nutrition. One of the other risk factors that I was talking about is psychological risk factors. Um, This could be a poor relationship with one or more parents, a neglectful or absent parent, somebody who is not really involved, difficult or inability to form social relationships or process social cues. And then the last type of risk factor are the social risk factors. They include poverty, living in a chaotic environment, abuse, obviously, neglect, lack of supervision, uninvolved parents, inconsistent discipline, and family instability, such as divorce or frequent moves. So this is what ODD kind of looks like in the classroom. Um, and it also kind of looks this way in, amongst peer relationships and also amongst the family itself. So during preschool years, or during preschool, like, well, preschool and a little bit of elementary school, it's they have a low patience level. They display a lot of aggression, increasing difficulties with peer relationships, gradually becoming more openly defiant towards adults. During elementary school, you'd probably see something like behaviors that may continue across home, school, and community settings. That's when they start seeing academic problems. They become starting to become impulsive, and they're a little bit more restless, and they have a variety of disruptive and aggressive behavioral difficulties. In the junior high and middle school years, um, they have academic difficulties, obviously, a loss of interest in school. The relationships with their peers is pretty low. They start to begin lying consistently. They may steal things. They become truant, or they might start running away because of their relationships at home. They start to use alcohol, drugs. They begin exploring or sexually. They have increased problems with low self-esteem and depression. And once they become adolescents, once they start entering high school, it's more of the same stuff, truancies, dropping out, getting suspensions, increased involvement with and loyalty to delinquent peer groups, greater isolation from other peers, uh, and their family members, stealing, like I said before, running away, alcohol and drug abuse, sexual promiscuity again, and problems with low self-esteem, low confidence, and or depression. And so I guess the common theme with all of this is that students with ODD are consistently challenging class rules, and they refuse to do assignments. They argue or they fight with other students, not just other students, but they argue and fight with teachers and other people of authority. And so this can cause a significant impairment in both their social life and within the academic functioning also. So classroom strategies and accommodations. So I divided them up in behavioral and instructional strategies and accommodations. So as far as behavior is concerned, one of the things that we can do, there was a lot of articles and a lot of websites that gave a lot of information. I chose the ones that were repeated constantly. So these were kind of like the ones that were highly recommended by most research. And so one of the first one it says is decide which behaviors you are going to ignore. So most children with ODD are doing too many things you dislike, um, to include all of them in, if you have like a behavior management plan. And so you can't really include all of them. So you need to target only a few of the most important ones, most of the important behaviors, rather than trying to fix everything all at once. Um, Making the student a part of any plan to change a behavior. So obviously you want to make sure that they feel included in the behavior management plan or whatever it is that you're trying to do, because if not, you're going to be considered the enemy by that student. And once you do that, you've already set the tone for trying to change these behaviors, and you're going to be considered, the student's enemy at that point. Um, Providing consistency. So obviously you want to create structure, and you want to create also clear consequences for the student's behavior. You want to make sure you set that right off the bat. Praise students when they respond positively. Obviously, you want to praise students. Positive reinforcement is always a great thing. You never want to raise your voice or argue with the student. Regardless of the situation, you don't want to get into, any type of verbal altercation with a student. I mean, it's going to be difficult, but silence is definitely a better option. Um, and part of it goes along with the next one, which is avoiding all power struggles with a student. Um, but once you get into a power struggle with a student with ODD, it doesn't really go anywhere because that's kind of what they thrive on. They thrive on uh, arguing with someone else, having that verbal exchange, and you kind of want to pick and choose your battles because you want to make sure that because you can get into a pretty long and exhausting verbal altercation with a student, and it might be for something very small or minuscule, and in the end you might regret it because it probably didn't mean all that much. So you want to make sure that whatever, if you do get into a power struggle with or at least not a power struggle, but some sort of verbal exchange, you want to make sure that it's something worthwhile. Um, and always listening to the student. You always want to let the student talk because a lot of them feel like they're not being heard. So you want to make sure that they do talk, you do give them the opportunity, and you don't interrupt them until they actually finish. So for instructional strategies and accommodations, the very first one, you want to make sure you establish classroom rules. You want to make sure that they're clear and it's non-negotiable, so that a student with ODD can't manipulate it in the future. You want to make sure that academic work is at the appropriate level. When work is too hard, students become frustrated when it's too easy. I'm sorry, they become frustrated when it's too hard, but when it's too easy, they become bored. So you want to make sure that they're completing the appropriate level work. Um, you want to pace the instructions. So um, when the student with ODD completes a designated amount of or a designated amount of work that the student doesn't want to do, you want to reinforce their cooperation by allowing them to do something they prefer or something that they find more enjoyable or less difficult. Um, you want to include so you want to teach social skills. You want to include anger management, conflict resolution, how to be assertive in appropriate manner, how to be assertive in an appropriate manner. You want to discuss those strategies with the students. Um, Select materials that encourage interaction. They need to learn how to talk to their peers, obviously. They need to learn how to talk to the adults in an appropriate manner. And those are some of the things that we obviously can do as school counselors. You also want to minimize downtime and plan transitions carefully. So students with ODD do best when they're kept busy. Like I said, mentioned before, they don't thrive when they're bored, or they don't thrive when the work is too difficult. You want to make sure the students with ODD are definitely being kept busy at all times when their minds are continuously going. And these are my references.